Meanwhile, in health, stakeholders of the health sector are calling for collaborative efforts between the state and non-state actors to stop the acceleration of cancer. Led by Amref Chief Executive Officer Githinji Gitahi, the stakeholders said there is need to strengthen action plans on cancer prevention and remodel healthcare financing to ensure quality and sustainable health services towards prevention and treatment of cancer.
The chairman, please.
As the international community prepares to mark the World Cancer Day, stakeholders in Kenya are calling for commitment of various stakeholders towards reducing cancer burden by ensuring those diagnosed access quality treatment. During the last day of the Cancer Summit, themed Uniting Our Voices and Taking Action, health stakeholders call for remodeling of healthcare financing to reduce the cancer burden on Kenyans, who from time to time are forced to seek medical attention overseas due to inadequate facilities in the country.
It is us who have to go back and tell the people, please go back to the traditional foods. It is us who have to tell people, please stop smoking. It is us who have to tell people, reduce the consumption of alcohol. It is us who have to activate for the government to increase allocation to cancer from 2%, 0.5% actually, of our total health budget. Only 0.5% of our total health budget goes to cancer.
The need to stop the acceleration of cancer in the country and to focus on improving quality of service and equity in access to health benefits among all Kenyans, and more so, the most vulnerable in our communities. We appreciate that we can achieve this through collaboration, partnership among national and county governments, development partners, private sector, CSOs, and communities.
Top 3 reported cancer cases being breast cancer at 15.9%, cervical cancer at 13.3%, and esophagus cancer at 11.8%. Stakeholders want diagnostic infrastructure advanced across the country, as well as increased sensitization to ensure cancer cases are noted at early stages of screening.
Cancer is not a technical issue. It has social dimensions, has political dimensions, and therefore involves everybody. It's actually a whole of society issue. We know that on the prevention side, we're talking about the food we eat. We're talking about how cities are planned. We're talking about lifestyle. We're talking about urbanization and what urbanization does to the risk factors of cancer. We're talking about the national environmental management. We're talking about climate change. We're talking about pollution. We're talking about all these things, and therefore we cannot assume that it is a Ministry of Health issue on its own.
Build the capacity of healthcare workers, especially at primary healthcare facilities, to strengthen early detection of cancer, and community health workers on how to package messages for the community members about cancer risk factors and disease prevention.
In the 2021-2022 report by the National Cancer Institute of Kenya, Nairobi, Nakuru, Kiambu, Machakos and Nyeri lead with the highest cases of cancer reported. For Easy Friday, I'm Gladys Mungai.